Barbadian workers will be paying the health levy come payday. A trial date set for former government minister Donville Inniss. And Cuba's ambassador to Barbados says farewell.
Credible, balanced, committed. This is the CBC Evening News.
Good evening, I'm Shane Jones, leading the news at 7. Students of the University of the West Indies Cave Hill campus have a major role to play in nation-building efforts. During a conversation with staff and students at the campus, Prime Minister Mia Amor-Motley reminded the students of their duty to the nation. She says as Barbados has given them the luxury of free education, they must play their part when their country and people are in need.
Administration, where she avails herself for frank discussions with specific interest groups, as well as the country at large.
That means community practice and nursing and gathering information. For those who are engineers working in construction, for those who are social workers, we have too many elderly people living on their own in this country who do not know what it is to interact with anybody, and for whom the opportunity to be able to have that kind of support and kind of interaction will be worth a ton of gold.
Minister in the Ministry of Finance, Ryan Strawn, is confident standards will improve at the Queen Elizabeth Hospital through the recently introduced Health Service Contribution. Effective October 1st, 2018, the Health Service Contribution was introduced at a rate of 2.5%. 1.5% is being paid by employers and 1% by employees and self-employed people. Mr. Strawn, as he led off debate in Parliament on the second reading of the National Insurance and Social Security Bill 2018, assured this money will go directly towards the hospital.
This particular measure, yes, will take a little more out of persons' paychecks, sir. We acknowledge that. But fundamentally, sir, fundamentally, it is the provision, sir, of the services in the national good, sir, that is important. And so therefore, sir, the health of a nation, sir, the health of a nation has to be developed, the health of the economy.
Minister Strawn says government also intends to address its arrears owed to the National Insurance Scheme.
Every single Barbadian must be aware that the government of Barbados will be paying the arrears for national insurance contributions for the public servants, which they work, sir, and they deserve to be covered. But going forward, sir, we shall be current with respect to not just the national insurance contributions that are currently due, but certainly this health service contribution, sir, which will now come on stream effective October 1st. Now, sir, as we know how national insurance works, the 15th of every month, the month following, national insurance contributions are due.
Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostic, says the health service contribution is not an imposition and should be viewed by Barbadians as an investment.
Each and every one of us who make this contribution, we are investing in our health care and the health care of our children, our grandchildren, our families, and our loved ones. And it is not that this government wants to take taxes out of the pockets of ordinary Barbadians. It is because we have a responsibility to the people who elected us. And we were elected by the people to serve the people. And part of that service is the provision of high-quality, universal health care.
Opposition leader Bishop Joseph Atherley is questioning if it's legal for the health service contribution to not go into the consolidated fund. The money is being collected by the National Insurance Board and will be sent to the Queen Elizabeth Hospital. Bishop Atherley suggests the process does not comply with the law. He quoted from the Provisional Collection of Taxes Act to support his contention.
It includes all assessments, charges, duties, fees, rates, impositions, and other levies, however they are called, the proceeds of which are payable into the consolidated fund as part of the revenues of Barbados. It is being insisted, it is being emphasized today that these monies collected as part of our national insurance contributions will not be paid into the consolidated fund, but will be paid into the National Insurance Fund intended for the operations of the QEH.
However, Minister Strawn says the method is on sound legal footing.
There's already a provision for a health service contribution in the Act, sir. And so therefore, this amendment, sir, just seeks to bring regularity and specifics to the dates for which the provision now becomes effective, and two, that the monies collected through the National Insurance Board will be directed to the QEH as opposed to the consolidated fund, which is what is currently in the Act, and we're making those amendments, sir.
Former Barbados Minister Donville Inniss is to stand trial on June 24th next year. The 52-year-old Inniss pleaded not guilty to 3 counts of money laundering in August this year. He will appear before United States District Judge Kiyo Matsumoto at 9 a.m. The June date was given at his hearing today when the court granted the party's request for a trial date and a motion schedule. Mr. Inniss must serve and file his motion by December 14th this year, while the federal government's opposition is due by January 4th next year. Now, after 4 years serving as ambassador of the Republic of Cuba to Barbados, Francisco Peña is saying goodbye to the island. He was given a fitting farewell at the Palm Marine Hotel. During the send-off, Minister of Foreign Affairs and Foreign Trade, Dr. Jerome Walcott, said Barbados and Cuba share a very close and healthy relationship. He adds the leaders of both countries recently reconfirmed and recommitted to all bilateral manifestations that represent the relationship.
These include, but are not limited to, the areas of tourism, health, the creative economy, culture and sports, renewable energy, maritime affairs, and of course, education. Ambassador, there is no denying that you have accomplished a great deal during your tenure here in Barbados. As you know, there remains considerable scope for cooperation in the many areas of common interest.
Ambassador Peña left Barbados with a message of Caribbean unity.
Cuba is not Cuba and the Caribbean. We are the Caribbean. And we cannot say today, unfortunately, we cannot hear all of our friends referring to Caribbean in this way because of the master power, the colonial master power. But the Caribbean is these Dutch countries, French countries, English countries, and Spanish countries. So we are the Caribbean.
Today is the 8th anniversary of the death of former Prime Minister and parliamentary representative for St. John, David Thompson. Thompson, who was the island's 6th Prime Minister, died on October 23, 2010 from pancreatic cancer. 8 years on, several residents in the rural parish still remember him, especially for his personality, mannerisms, and the physical improvements he brought to the area.
He was a good man. He used to do anything for the young ones, the young youngsters about the place. Very good. You could ask him any question. And if you had difficulties, he was always there for you. I miss him dearly.
He was a friend of mine, but he was a people's man, and a man that you can go to at any time. Don't care how vexed you are or whatever you tell, don't panic. And he's the type of man who would do things for you without charging you or think, because he's that type of person. Well, I travel, he took me to St. Lucia, he took me places enough with him and so on. And there's lots of things he did for me and my family that, well, my family on my wife's side, he did a lot of things, so I can only say that he was a brilliant man.
He was a community man. He was all around with Barrow and John and Harriet and all sorts of. And he always had time for us.
He do the clinic, you know, and he do the pavilion, yeah. And he try to do other things, but you know, it didn't last long enough. Yeah, he will do more. Honestly, he will do more. He's a people's man. He always around. You know, you always see him. Always seeing him. Small shop, you know, footballers, always there.
The Sanitation Service Authority owes private waste haulers more than $23 million. This revelation from Minister with responsibility for the SSA, Trevor Prescott. Mr. Prescott says their shortage of garbage trucks forced the authority to outsource some of its services.
13 trucks to cover an entire nation. We had to go to private haulers and keep renewing the contract for the private haulers every few months. And some months we are in a situation where we cannot pay them. Every week I use the drainage department trucks more than the ministry that the trucks belongs to in order to meet the demands for the removal of garbage across Barbados.
Minister Prescott also defended government's decision to implement the garbage tax on water bills.
It was a necessity because the Transport Board is in the red. Not the Transport Board, the Sanitation is in the red. We have to get it out of the red. We not only want trucks, we want a compactor. We rent, and I don't even want to tell you how much money we pay C.O. Williams for the compactor. The amount of money, all I can tell you the amount of money that we pay in a year and a half to buy the compactor.
Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostic, says government is doing all in its power to keep nurses in Barbados. The island and many others in the Caribbean are facing a challenge with respect to the migration of these healthcare professionals. Minister Bostic commended the island's nurses, telling them they are the backbone of a functioning healthcare system. He gave the assurance that no stone will be left unturned under his leadership to improve the profession. The commitment was given during his address at the 31st Biennial Conference of the Caribbean Nurses Organization at the Hilton Hotel. He revealed government has received the report on the Nursing Migration Study 2017 and intends to make the necessary interventions in accordance with the recommendations. The minister also revealed government will establish the post of Senior Specialist Nurse.
This intervention is to facilitate the retention of our most skilled nurses within the nursing operation ambit, so that we do not lose them to administrative tasks and roles, because that is the only way at present for upward mobility.
Colonel Bostic says the 2018 theme of the CNO conference, Nurses, Transformational Leaders Advocating for Quality Healthcare, complements the overall vision of the government for promoting quality and sustainable healthcare for every citizen.
This conference will empower over 300 nurses from the Caribbean and beyond to take responsibility for their own professional and personal growth and development in a manner that will be recognized globally while informing health policy decisions locally and regionally. As your organization seeks to lobby institutions of higher learning and the regional nursing body to provide opportunities for nurses to advance their nursing education, you should also instill in your members that it is in their interest to take responsibility for furthering their own education.
President of the Caribbean Nurses Organization, Elnora Warner, says the role of nurses is tantamount to that of national security personnel.
In these days where there is an increase of the occurrence of new and re-emerging diseases, the scourge of non-communicable diseases on population, increasing crime, which appears to be advancing as one of the leading causes of death in our region, are just few of the areas where nurses are positioned right at the front line of care. In a time when we are living in a borderless world, Nurses play a critical role in protecting our national borders.
Vice President of the International Council of Nurses, Dr. Pamela Cipriano, is telling Barbados and the region that as the world changes, the pressures on the healthcare system are unabated. She says healthcare is now required to be on demand and leaders have high expectation of nurses. The visiting ICN official says nurses must have a seat at decision-making tables.
We don't need to be told what to do. We need to be part of saying what needs to be done. Right now, all over the world, decisions are being made about the delivery of health care. Government leaders, decision makers, and medical professionals are holding discussions on healthcare policy, hospital and health facility locations, and environments in the delivery of health services to our communities. Unfortunately, for the majority of these discussions, a nursing professional is missing from the decision-making table.
The Queen Elizabeth Hospital is introducing several new measures to cut down on the time spent waiting to be seen in the Accident and Emergency Department. Chairperson of the hospital, Juliet Bynel-Sutherland, says the ultimate goal is to have patients seen no more than half an hour after they arrive. That's why they will be introducing a doctor triage.
You sign in and you get to see a doctor. That doctor very often can give you what you call a clinical disposition, can make a decision. Okay, from what I see here, this is something that is not so urgent. What I'd like you to do, here's a prescription. This will alleviate some pain. You can go to the polyclinic or to your private doctor. So doctors you'll have that immediate intervention with a doctor.
Ms. Bynel-Sutherland says the establishment of 24-hour polyclinics will also help relieve some of the pressure on the A&E department. In the meantime, she says the QEH will be establishing a unit dedicated to treating patients with minor injuries.
Upstairs in the main corridor, where you see the reception desk is, just beyond that, there's actually a room that's being converted into a minor cases unit. So if you've been sitting outside in the accident and emergency room and you really have a matter that ideally could have been dealt with at a polyclinic, in the private, at a private doctor, at your GP, but you're with us, we're not going to turn you back. What we're going to do is treat you within the hospital at the minor cases unit.
Class 3 students of St. Albans Primary School now have an additional study tool to help them prepare for the Common Entrance examination and beyond. The 30-plus pupils received new tablets, compliments the Aaron and Christina Trust Foundation. Many of them are excited about the devices, plan to use them wisely.
I'm excited that I have my second tablet in total. I am going to use my second tablet to help me do my homework that I don't understand properly.
I feel great because my last tablet, it wouldn't work properly, and I like this tablet because this one is gonna download all these learning apps.
I feel joyful because my brother brought my last tablet, and I'm really happy that I have a new one, so when I'm doing my homework, it will hopefully help me.
I feel great, and I am going to play with it and do work on it.
Parliamentary representative for the area, Edmund Hinkson, was on hand and told the students the tablets can help to improve their IT skills.
Of course, we would have told the children that these tablets can have a direct influence on the work that they get, the employment or career path that they take when they become an adult, because we're into the age of digitalization and technology and computers, something that was unimaginable, 50 years ago, and that it is difficult these days to get a sustainable job and sustainable employment if you don't have computer and technological skills.
Legendary calypsonian Winston Bailey, known as the Mighty Shadow, is dead. The veteran calypsonian passed away this morning at the age of 77. Bailey was due to receive an honorary doctorate from the St. Augustine campus of the University of the West Indies this weekend. Relatives confirmed that Bailey died in hospital following a stroke last weekend. He was among 5 people, including former West Indian international cricketer Shivnarine Chanderpaul, who were to receive honorary degrees from the university. Bailey, a former Calypso Monarch and Road March winner, celebrated his birthday on October 4th. Longtime friend and fellow Calypsonian, the Mighty Gabby, expressed sadness at the news of Shadow's passing, stressing that he had a very unique style in the delivery of Calypso.
Shadow was unique, he was brilliant, he was simple, but he was powerful, and he was the best at economy of words. He would say things in a few words that would take many of us many words to say. He was just different and brilliant. And so we in the Calypso fraternity miss him and will miss him greatly as time goes on, because we don't have anybody with that style. You know, we know the great ones. We know Lion, Kitchener, Sparrow, Melody, and so on. But Shadow was just different and magnificent.